Thanks for joining us on This Week in Health IT Influence. My name is Bill Russell, former healthcare CIO for a 16-hospital system and creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. Today, Ed Kopetsky, the CIO for Stanford Children's, joins us. Ed is a CIO of the Year. He is a Lifetime Achievement Award winner. He has been around and done a lot of great stuff. We talk about their EMR journey. We talk about the role of digital in COVID, prioritizing projects. We talk about a lot of stuff. We close it out by talking about his role on the Opioid Task Force. And it really is one of the highlights of the show. So I hope you'll listen through to the very end of the show. I want to take a quick minute to remind everyone of our social media presence. We have a lot of stuff going on social media. You can follow me personally, Bill J. Russell, on LinkedIn. I engage almost every day in a conversation with the community around some health IT topic. You can also follow the show at This Week in Health IT on LinkedIn. You can follow us on Twitter, Bill Russell HIT. You can follow the show This Week in Health or in HIT on Twitter as well. We've got a lot of different things going on, and each one of those channels has different content that's coming out through it. We don't do the same thing across all of our channels. We don't blanket posts. We don't just, schedule a whole bunch of stuff and it goes out there. We're actually pretty active and trying to really take a conversation, in a direction that's appropriate for those specific channels. So we spend a lot of time on this. We really want to engage with you guys through this. We are trying to build a more broad community. So invite your friends in to follow us as well. We want to make this a dynamic conversation between us so that we can move and advance healthcare forward. Special thanks to our Influence show sponsors, Sirius Healthcare and Health Lyrics, for choosing to invest in our mission to develop the next generation of health IT leaders. If you want to be a part of our mission, you can become a show sponsor as well. The first step is to send an email to partner@thisweekinhealthit.com. Just a quick note before we get to our show, we launched a new podcast, Today in Health IT. We look at one story every weekday morning and we break it down from a health IT perspective. You can subscribe wherever you listen to podcasts at Apple, Google, Spotify, Stitcher, Overcast, you name it, we're out there. You can also go to todayinhealthit.com. And now on to today's show. Today, we are joined by Ed Kopetsky, CIO for Stanford Children's Health. Good afternoon, Ed. Welcome to the show.
Well, thank you, Bill. Great to see you, and appreciate being on this discussion.
Yeah, I'm looking forward to the conversation. It's I've had Teresa Meadows on. We talked about some of the children's health things through the pandemic, and I want to go further with that with you. But since you're a first-time guest, let's start with, tell us a little bit about Stanford Children's and what you guys are doing there.
We're actually now the largest pediatric health system in Northern California, and we have over 50 locations. So really within 10 minutes of every patient in the Northern California area. We've grown tremendously since I came here 12 years ago. We've gone from 600 million to $2 billion. We've tripled the size of our hospital about 3 years ago, and probably one of the leading research and discovery health systems and medical schools for pediatrics in the country. Just a hub of innovation and clinical research around pediatrics. And of course, we sit in the middle of Silicon Valley, so there is no shortage of good ideas and people wanting to innovate. So it's quite a hotbed of fast pace and innovation and creative thinking, including on our board.
Well, a couple of things about that are interesting to me. One is 50 locations, and we sort of heard the same thing from Teresa Meadows in out of Fort Worth. Children's hospitals have really gone retail. I mean, they're in the neighborhoods, they're out and about. And so there's a lot of different ways to get care for your children that didn't exist before. The other thing that obviously jumps out is, in the middle of Silicon Valley, we're definitely going to talk, digital health and what's going on there. So you guys have a pretty significant I don't know if it's called a retail strategy for you guys or just being out in pushing out into the neighborhoods.
Right. Well, Bill, one of the things unique to pediatrics is that for every patient visit, it requires an adult as well. And it's a lot of productivity loss, impact on the family. And so getting closer to people in their community improves access and it ultimately improves the quality of health status. And so when I came here 12 years ago, we were only a hospital. And I say that lightly because it was a significant hospital, but in the ensuing 5 years, we needed to go to market. It's more of a market strategy to extend access and also to leverage our specialists much more. You think we have very limited world-class specialists, and they're not going to be able to go out and travel to patients, and trying to bring everybody into one spot doesn't work well, especially with all the traffic issues and the waiting in waiting rooms and that. So, a market strategy coupled with digital health has been a real strategy for ours for about 10 years now.
Well, I want to go into that digital health aspect of it. We've been having some great conversations on the show just around this whole concept of going where they are, increasing access, care at a distance, so not putting people at risk. And yep. It's one thing we know for sure is that the COVID-19 does not spread through computer screens, or at least not to the person on the other side of the video call. So let's go there a little bit. How has digital health supported Stanford Children's response to the pandemic?
Well, let me give you a little background before I get into it. We are the highest acuity children's hospital in the country. We have the highest severity of illness of children, the case mix index. And so many of our patients need long-term care, not just an acute episode. And so our digital health strategy was developed under a motto I came up with of in our care anywhere, so that we are already getting to know the patient before they come for care, and we're keeping them in our care in partnership with their community physicians when they leave us. Many times, many of them need multiple interventions. And so we want to be able to monitor the patient's status as real time as possible without batch meetings and appointments, but continuously. And we've actually been a leader in developing glucose monitoring, also now congenital heart monitoring for patients with congenital heart disease. When COVID hit, I think that at the end of the day, CIOs are change leaders. We're not technologists, we're change leaders. And one of the best things that happened to us with COVID, the silver lining was adoption went through the roof. When there was finally a need, all the barriers went away. And our telehealth platform had to actually be replaced because the one we were on didn't scale. And so by 2-3 months into the pandemic, we converted out our telehealth platform. And what's really cool is that it has sustained itself and actually grown. We're seeing 850 to 900 visits a day now, where we used to see 20 max. And all of the providers are really interested in using it. It helps them. As you said, it helps cross-infection rates go down. And I think another really creative thing, Bill, 50% of our hospital is ICU level. It's, as I said, it's highest acuity. One of the other things we did, and it wasn't IS, it was our clinicians, we really innovated telehealth capabilities on the inpatient floors because patients had to be in isolation We've restricted access to the hospital during COVID to prevent cross transmission. And basically, the rounding teams now in the intensive care areas use a mobile, like a cow, computer on wheels, enabled with telehealth. So only one clinician goes in the room when they go on rounds for all these patients. And it's really prevented cross-infection. We haven't had one case of cross-contamination of COVID in our healthcare workforce since the beginning of this. No transmission from patient to provider. So we're really practicing the ultimate in safe practice, and telehealth technology has been one of the greatest tools we've deployed to help.
Let me make sure I got this right. In our care, anywhere, everywhere. Is that correct?
No, in our care, anywhere.
In our care, anywhere.
Yeah. And I think that's kind of the motto of our digital health program. And we've had quite a history on that. We didn't invent it at time of COVID. We had something to scale.
Yeah, no, I love that as an organizing principle. In our care, everywhere is a great organizing principle. Especially, I mean, COVID just accelerated everything that was going on, and that's what we have seen. It's.
I would just add, Bill, too, just one other, I think, differentiating thing. We also integrated the telehealth into our EHR. We use Epic here, as a lot of people do in Northern California, but a lot of health systems put telehealth on the side of Epic. We integrated it into MyChart so that the patient and family log right in to their MyChart account, schedule an appointment, and activate the appointment. Everything's integrated in the EHR environment, which is a real boon for both the family and the providers who are trying to deal with multiple technologies.
Yeah, single point of entry is great. So the organizing principle during the pandemic is safety and speed. Obviously, we're moving fast and we're doing it from a safety perspective. But how will you guys organize, and how will you determine what projects to do moving forward?
Well, it's a great question. I think 7 years ago, we formed a digital health steering committee. And, I'm a big believer in governance and inclusion and participation. So right away, we established an executive committee for IS, but subcommittees under it led by business owners. And in the case of digital health, some people thought the CIO should lead that. I did not. So I convinced our CEO that I should co-chair digital health steering along with our chief medical officer and our executive over ambulatory care. And it really worked. That committee has stayed together and expanded now. And it's also now led by, we have a dedicated director for digital health, and our CMIO is co-leader, co-chair of that committee. The CMO and the head of ambulatory and I are still on the committee, but we've been going for 7 years or more and evolving it. The priorities come in there into the meeting. There's a lot of good ideas, as I mentioned earlier, around Stanford and being in Silicon Valley, but it's a very thriving environment, and that's how we do it. It's through participation and inclusion of our business and clinical leaders. And I don't see how you could do it otherwise.
No, I agree. Yeah. So looking at priorities, as you guys continue to progress, it's interesting. You hear Stanford and you hear Silicon Valley, and you think, oh, well, you have unlimited resources, all the smartest people in the world, that kind of stuff. But the reality is, you have limited resources, budgets, and those kind of things. What do you anticipate the priorities are going to be coming out of the pandemic, whenever that is?
Yeah, I think that, we've learned a lot in the industry. It's almost embarrassing how much, there's no flu season this year because of our isolation and not bringing people into clinics, but using virtual care for appointments that you can do just as easily or better on video. So safety-wise and quality-wise, that's been a significant advancement. We also have a significant goal to improve access. And a lot of this, it's in really two ways. One is geographically, it's very hard to drive into Stanford from anywhere in Northern California. It takes a parent or another adult every time a child has to come for an appointment. But I think the other thing is for people who are underserved. Digital health can break the barrier of access difficulties and geo access difficulties. And we actually are starting a program with our foundation to enable technology for those that don't have access to it, so that we can reach a broader audience at a more, the later things happen, the worse the outcome. So the earlier we can get upstream and screening and saying, yeah, you should come in for an appointment, or no, we don't need to, you can do this. We're seeing tremendous growth in that and much broader access for patients. The other thing that happened during COVID is they relaxed the interstate restrictions. So we're seeing patients from other states now that we weren't able to before because of the relaxation on that and the credentials for that. I think I mentioned the other thing, that we treat very complex patients that are long-term, chronic, complex. And so we need to keep them in our care or be a partner in their care for long periods of time. And so we can predict when their next intervention is needed. Finally, I'd say this, Bill, one of the things that distinguishes us in our innovation and our digital health is that we literally apply it. We see a problem and we say, why can't we solve that problem with technology? And because of that, we're testing and iterating right in the clinical environment, as opposed to a laboratory that we now got to go pilot it in. We're actually doing it real time. So it excites our clinicians to see improvement, and we're right there improving the care process with real world problems. So
yeah, from a technology lens, I mean, more from an IT lens and less from a healthcare lens per se. So is access one of the biggest challenges facing pediatric health patients in California today?
Yeah, definitely. I mean, there's about 4 or 5 children's hospitals in the state. I'm trying to think. There's 2 here, 2 or 3 in LA, and 1 in San Diego. So, I mean, what's really interesting is I think pediatrics is only 6% of the population. So it's really hard to sustain. The issue is when children need care, and most of them don't, when they need it, it's bad. And so you're really restricted to these large urban area centers, children's hospitals. But where do most of the kids live? They're all over the state. And it's a big state, you know, we got 40 million people. So anything we can do to take friction out of access, whether that's an initial screening or continued monitoring in your home where we're capturing the data real time, anything that we can do like that improves access. And it broadens the access to larger populations.
Yeah, I want to come back to some pragmatic stuff, but I want to touch on, former CIO of the year. I don't know, do we say that former, or once you're a CIO of the year, you're like an emeritus thing?
Yeah.
Well, I mean, you not only have CIO of the year, you have a Lifetime Achievement Award. You've been doing this, I guess that says you've been doing this a long time. I guess the question is, what makes a great CIO? What distinguishes the good from the great CIOs in healthcare? What characteristics that have you seen?
Oh, that's a great question. Everybody asks me that, like, what are your critical success factors? And I think, the thing I said earlier, that CIOs are really champions of change. And too often we're put in a technology bucket, and too often we put ourselves into that bucket. And you basically isolate yourself. And that's the wrong thing to do. The best CIOs I know, they're constantly out there as an executive. They know the business, they know the support services, they have trusted relationships with their colleagues and throughout the organization. They're a change leader and a developer of capability and people. I would say, more importantly, they're a servant leader. They're not here for themselves. I can't do anything myself. It's all about the team I develop and the trusted partnerships I develop with all the business and clinical leaders. And if we're a servant, they're going to come and ask for our help. And I found this over and over again. If you have the right attitude about learning and finding out more and investigating and going out there in the business, not sitting in an office somewhere and you never see frontline business, that's the key. I think one thing that really worked great here was we launched a lean management system, and I was part of launching that. And that really teaches you that you're here for others and growing capability. The team I've developed here is totally leading edge and scalable and resilient. And we have some of the best leaders in healthcare in my own team right now. And that's what you want to do, because then they bring on the people that want to work in a development environment like that. So I've just been amazed at what we can do with the right kind of thinking and approach in looking out for others, fundamentally.
I agree with you. It is a role where it's definitely not about you. It's about how you're going to serve. But the aspect of developing a team around you, that seems to be, and I've talked to a lot of CIOs now, and the ones that are able to not only identify and hire good talent, because even average people can do that, but develop that talent. That seems to be one of those characteristics that really differentiate the good from the great CIOs, the people that are able to develop the next generation of leaders that are just going to step in after they move on to the next thing.
Absolutely. I have literally 7 or 8 or 9 people that have all been through the Chime CIO boot camp. Our CMIO is faculty in the CMIO boot camp, and they're national leaders. Bill, I think the other thing I'd say is great CIOs have great networks. I can call up practically anybody in the country, and they'll take my call, and vice versa. And it's not just, Chime is a great example of that. There's other groups like the CHA, Children's Hospital Association, CIO group. High C is another group I'm a member of. But we take this stuff seriously to help each other. And I can tell you without doubt, decisions are made between peers. They are not made between a sales pitch and a client. It's your reputation is your marketing arm and nothing else. Yep. To be quite frank, it's not based on experience, and we all talk. So having a network that you are respected in is a significant success factor, in my opinion.
Absolutely. Well, let's get back to a couple of pragmatic items. Regulatory is huge. It's always huge. How are you guys doing with regard to the transparency rule and 21st century cures for that matter?
Well, right before it was supposed to be live, there was a delay. And now there's a lot of debate on the April date whether pediatrics should participate. There are a lot of unique privacy issues that come into play around pediatric patients. And in fact, Apple's health record doesn't even work for children today because of those privacy restrictions. One of them is that after the age of 12, the parent can no longer have access to the health record of the patient without the consent of the patient. So we have to literally hide the data from the parent who already has access to the record. That's a great example. So, and those laws might vary by state also. So one of the things we just did last week, Bill, we had our IS exec committee, and our CMIO, who's none of these people work for me, I work for them, but she is a big proponent on pushing the boundaries with this, and we are going to go up with it in April for our pediatric institution, and we're going to keep working with our vendors and others who come in to promote the unique needs of pediatric data sharing, which exist out there through regulatory and other reasons. So we're doing well. We got a lot of work done. We are anticipating challenges, but we want to be on the forefront of this because we believe it's part of the next level of iteration and innovation. The more you can engage the patient and family in their care, the better the outcomes. And we've never not proven that. So that's the goal.
So the transparency rule calls for, shoppable services to be put out on your website. But in pediatrics, it's interesting because, again, all these things are sort of done, federal, here's the rule, here's what we'd like to do. But it's interesting how different it is for pediatric. I mean, you're talking only 5 pediatric hospitals in all of California. But anyway, the transparency rule calls for that. Have you guys made a lot of progress on that, getting the shoppable services?
We just went live last week on our first set of shoppable services and price transparency. And we really had a lot of debate around that because, as I mentioned, we're a very high acuity tertiary quaternary children's hospital. So we really don't have comparable services that are easily shoppable. Now, some are and some aren't. So we took a subset of those, and on the 19th last week, we went live with our first set where you've got total price transparency on cost, what your portion is, et cetera. It's a new field though, and I can't really judge it within 6 days, but I suspect we'll learn some stuff there. One thing, Bill, and we're real proud of it, I forgot to mention it when you asked about Stanford Children's, but we were rated top 10 children's hospitals in the country by U.S. News and World Report this last survey, and we intend to stay in that group, keep pushing it up. So, I mean, that's the kind of place we are, and when you are at that level, you have a lot of costs of research and development and experiment and data sharing, et cetera, that most community hospitals don't have.
Yeah, absolutely. Talk a little bit about your EHR journey. You guys have won some awards. You guys have made some good strides there. Give us an idea of where you're at.
Sure. Well, I think I'll just relate back. I can't believe it's 7 years already, but in 2014, we did a massive conversion to Epic. We had Cerner, we had Meditech, we had NextGen. We had this.
In one hospital, you had that?
No. Well, in our hospital, we had Cerner and Meditech.
Okay.
In
Wow.
our clinics, we had put up, I think it was NextGen, it might be the other one, but we had been acquiring all these practices for 3 years, and we were converting them to an interim solution. And then the board and leadership said, hey, 90% of Northern California is on Epic. We can no longer be an island. Let's get it done. And we were doing so great with it. Oh, I got to brag a little. Our plan was to convert the hospital in the summer of 2014, and then over the next 2 years, convert all the clinics. And we fundamentally did the whole thing in 4 months. It was a heck of a summer, but we became an enterprise because of it in 4 months, not 2 years. And we had the talent here, we were under budget, and we said, let's keep going. All we're gonna do is develop interoperability for 2 years and have a fragmented system. So we put the pedal to the metal, and between May and September, converted the whole enterprise. We had tremendous results. We saw a 10% uplift in net revenue just by better practice. But more importantly, we were connected nationally with every other Epic-enabled environment, and data sharing was immediate across the country. Now, fast forward a couple of years, of course, that first year was tough. You've got to build a training team, and you've got to, you don't get the gains on day one. It takes quite a while. But I have to say and highlight the biggest award that I'm most proud of in my career is the Davies Award. And we got that award in 2017, only 3 years after go live. And we didn't have just 3 cases, we had about 8 of showing improved outcomes on a sustained level of more than 2 years using our IT and analytics and our EMR. It was a huge success and a huge win for I think we have a world-leading clinical informatics program here. We actually have a fellowship program that it was launched at Stanford. It was the first credentialed program in the country, and our CMIO is director of that. Stanford Children's is actually the host site for it. So we're cranking out new clinical informatics leaders every year. We subsidize over 12 of them a year, part-time in IS here, in the information services, and they're innovating in the clinical environment constantly. Our latest award was last year with achieving both HIMSS level. We had HIMSS level 7 for inpatient and outpatient. We got that in 1 year after our go live. We recertified last year and got HIMSS 7 for analytics as well. So we were at the time one of only 7 organizations in the world to have both certifications.
Wow.
So this isn't a one-time event. This is a continuous innovation hub here that's going to keep going well after I leave someday.
Yeah. Yes. At some point, you're going to have to leave. You have to make room for the great talent behind you. So interoperability. So you're now not an island. You guys are connected in through Epic. Are there other aspects of interoperability that you have to look into, or does Epic really take care of a majority of it for you?
Epic takes a huge chunk in terms of Epic sites. We also participate in an HIE for all other. So we are doing data sharing with others. I mean, many sites still have Cerner, for example. And we have to partner with everybody. The children's hospitals are kind of like the Switzerland. They have to partner with everybody.
Yeah.
Another thing we've done, though, is we are a major player in data registries nationally at practically every major illness or disease. And we participate in both the registries and collaborative research with other children's hospitals across the country. So there's a lot of issues there in terms of interoperability. Both the adult hospital and the children's feed their EMR data into the School of Medicine, into their research database to do controlled research also. So now we take away the identity and all that, but a lot of research goes on with our combined data sets at the School of Medicine as well. So a lot of stuff going on. And of course, we partner with vendors who are on the leading edge and trying to get things moving, like Apple and Google and health records and stuff like that.
Yeah, it's a great place. Actually, I get this picture, and I'll just have to ask you the question. I mean, you're at Stanford, and you're in Silicon Valley. How often do you have some fairly young kid or grad student in your office saying, "I've got this great idea for healthcare," and you just start batting things back and forth?
As often as I let the door open.
That's what but wouldn't that be the fun part of the job? These guys they're brilliant.
Well, they are. The only thing is they don't see the whole. Right. They only see a piece. So that's the hard part. But we do have an environment here to accommodate that. As I mentioned, the CI Clinical Informatics Fellowship and also the program we have at Children's with 12 or so MDs every year cranking it out. We actually have a partnership agreement with this College of Engineering, and they actually have students working in our healthcare system making improvements in process and technology, workflow, etc. And it's called the SURF project, Stanford University Research Foundation or something. We also do, I guess it's our environment. We're here to develop people. And we do a lot of interns. If it's summer or even a year, we'll take them in and they'll work in an area in our department like business systems or web technologies or analytics, and they're learning as well as growing while they're working with us. So quite a bit. I won't even mention Silicon Valley, but we're here to encourage that mind too.
Right.
Because it is an academic medical center developing our future generation. So that's kind of a different role than I've had.
Any interesting projects with AI, machine learning, RPA? I mean, you have Stanford in your name. I'd have to ask the question.
Well, I think there's a lot of it, and the Center for Biostatistics and the school is a partner in all this. But just at a high level, at Stanford, we have one of the largest imaging archives in the world. And we are now mining that data to look. It's amazing. You're looking for discoveries in history. And how we do it, we look at patient conditions, and we can now search that entire archive and look for patients like this and what interventions were done and what happened. So we can look in arrears at leading practices and discover correlations. It's happening already. We're also building that into decision support tools into our Epic EMR already. On a non-clinical side, we're active in robotic process automation. This industry is full of new terms, right? But fundamentally, we are doing leapfrog improvements with minor investments, with just applying principles of process and technology automation. And our biggest wins right now are in finance and revenue cycle, but we have a much broader digital transformation agenda that's going to, extend throughout the enterprise. And our new leadership team, we've had a lot of leadership change over the last few years, but definitely adopted it. It's top of mind in our IS exec committee. And we've really stratified 4 domains where we are actively cranking it out in digital transformation. The one of them is in the provider space. The other is patient and family. The other is business operation. And the fourth is in growth and the market. And all 4 of those domains have active digital transformation initiatives underway right now.
Gosh, you take me there. I want to ask like 50 more questions, but we're coming up on our time here. But and I'd be remiss if I didn't. I'd love to hear more about the work on the opioid task force. You've been co-chair and have established not only a foundation for the conversation, but action plans for health systems, some things they can download and just immediately implement. Tell us more about the work of the team.
Yeah, thank you. I'm so honored to be part of that. And just in 3 years, we just actually we're 3 years tomorrow when we launched. And what's really cool is we built, first of all, we had 30 or 40 volunteers just show up for 3 years. And they're from all walks of life. They're from the vendor community, our partners on the foundation, and CIOs and others. And we have 4 or 5 task forces that work under there. The latest one we added this year is a clinical, because the work is not for CIOs. The work is for our clinicians, those who are treating people with substance abuse problems and addiction, and in particular opiates. But one of the first things we built was a playbook, an online playbook for hospitals written by clinicians, and it's free. It's on our website, and it's now already being updated by that clinical task force that we just formed, and it's made up of leading edge clinicians in addiction medicine. We also raised some money after the Chime seeded our cost the first year, and then we raised some money the second year, and we built an opioid action center. That's a public utility website hosted at Chime. The playbook is hosted on there. All of our webcasts you can go on and listen to leading experts talk about what they're doing in this space. We're now starting up a series of podcasts, and they're going to be shorter in length, but they'll also be housed on the Action Center. And the first series is going to be led by a good friend of mine, Bill Spooner, who I worked with at Sharp for a long time, and he's really working in his community with his health system. And the key is that it's beyond the hospital. This is something at a community level, and hospitals, we've got to figure out how to optimize the hospital role in the community intervention in mental health at a broader level and addiction more finite. And that's where some of the interoperability goals we have come into play there. Addiction is not an acute illness. It's a chronic, lifelong illness. And the majority of care that patients get is in the community. So we really need to think about how to leverage the hospital to improve the communities they serve. And a lot of work leading edge going on there. But I'm just truly honored. And I can tell you, we just had a big meeting last week, the whole task force. And again, 30 people showed up in the middle of all this stress and contention with COVID and that, and they all said it's even more important now. Because what happened when COVID hit, mental health went to the wayside again, and access went down, our overdose mortality rate is up at least 50%, at least. And we think it may be doubled. So big problem. And again, not one that's always at the front of the line. When it comes around the funding, insurance, I fought for years for insurance funding for my son who had addiction. And, you know, there's a lot of issues in that space. And I just honestly, it was one of the most rewarding things to be asked to co-lead this and move the needle, I hope, in this space.
Yeah, I mean, the work you've done is fantastic. I've looked at the playbooks. They're great. Pull them down, and they're being updated. That's great as well. Yeah. I mean, but if your program is not off the ground, it's a great way to kickstart it. I was reminded of how important this topic was. The Tiger Woods, what is it, special or episode? I forget what they call them now because it's not a special. It's on ABC. Documentary. I mean, and it's amazing because we love people who have addictive personalities because Tiger Woods is addicted to golf and he performs at such a high level and we're drawn to it. But that same thing led to, addictive recovery from surgeries and those kind of things. And he got addicted to drugs at the opioids at certain point in his career as well. And it's something that really affects every community and every health system has a role to play in this. So I love the work that you guys are doing. I really appreciate your service to the community on this.
Well, and the friends you make through this, it's just incredible to work with colleagues and, we've got leaders from Epic and Cerner and Allscripts in the room, and they're evolving their products to improve things. Our associate CMIO is now helping with the Most Wired survey and adding in critical questions around opioid management in hospitals in the next Most Wired survey. So kind of that's what we do.
Fantastic. Ed, thank you. I know this is a really busy time for you guys. Thank you for taking the time to sit down with me. I really appreciate it.
Well, Bill, it's an honor to do that and a privilege, and anything I can help with, I appreciate it. So thanks very much for asking me to do this.
Absolutely. What a great discussion. If you know of someone that might benefit from our channel, from these kinds of discussions, please forward them a note. Perhaps your team, your staff. I know if I were a CIO today, I would have every one of my team members listening to this show. It's conference level value every week. They can subscribe on our website, thisweekhealth.com, or they can go wherever you listen to podcasts, Apple, Google, Overcast, which is what I use, Spotify, Stitcher, you name it, we're out there. They can find us. Go ahead, subscribe today, send a note to someone and have them subscribe as well. We want to thank our channel sponsors who are investing in our mission to develop the next generation of health IT leaders. Those are VMware, Hillrom, Starbridge Advisors, Aruba, and McAfee. Thanks for listening. That's all for now.